Hello, my name is Liz Stokel. I'm an infection prevention and control nurse working for South Tyneside and Sunderland NHS Foundation Trust. We're here today in Haven Court Care Home, and I'd like to take the opportunity to thank the staff and residents for their hospitality. You may hear some background noise because of the setting. Today, I want to talk to you about caring for residents and staff in care homes during the coronavirus pandemic. First of all, the key safety measures to keep everyone safe: social distancing, effective hand hygiene, safe use of personal protective equipment or PPE, and prevention of contamination of yourself, others and the environment. Social distancing in care homes. We recognise that at times staff and residents are quite close to each other and recognise that this is a necessary part of care. But when you don't need to be close to a resident or another colleague, we would advise to socially distance by the 2-metre rule. It's also important to assign a staff member to those who walk with purpose, and this where possible, recognising how busy homes are. Avoid card sharing with other members of staff, as this can increase risk too. When to undertake hand hygiene. It is important to clean hands at key moments, on arrival and on leaving work, immediately before and after touching a resident, immediately after touching anything within 2 metres of the resident. When they look or feel dirty, before putting on and removing PPE, before handling or preparing food and drink, after using a toilet, before and after break times. It's also important to wash hands when using a tissue to blow your nose. Hand hygiene. It's really important to cover every step, every time, and that you take at least 20 seconds to perform hand hygiene. When moving between residents, you must wash hands to the elbow. Each care home has a poster over the hand basin to remind staff of every step. So take one glance at that at the end to make sure you've covered your hand hygiene. Areas most frequently missed. This poster shows the front and the back of the hand, and the colour denotes how frequently missed it is. And the most frequently missed are the areas with the deepest red, and very often they are the thumb, the backs of the fingers, and in between the fingers. Safe use of personal protection equipment, PPE. For general contact, not aerosol generating procedures, staff can wear disposable gloves and a disposable apron, fluid-resistant surgical mask, eye protection goggles or a visor if the resident is COVID-19 positive or the resident is coughing and sneezing. If an aerosol generating procedure is being performed, for example, suction of a tracheostomy, a higher level of protection is needed, and this poster demonstrates on the right-hand side the higher level of equipment required. So preparing to put on PPE and prevention of contamination of yourself, others and the environment. The do's. Before putting PPE on, do have a drink and go to the toilet. Tie your hair up if long and give yourself time to put PPE on properly. Ensure that you have the equipment that is the right size for you. The preparation is really important because you can't adapt and amend your PPE once it's in place. The don'ts. Do not touch your mask when it's on. This could contaminate your hands and then you could go on to contaminate other areas. If touched, wash or gel your hands immediately. Do not take PPE off and leave it on surfaces. Put PPE straight into a clinical waste bin. Do not have your mask hanging under your chin or off one ear. This causes contamination of your neck and your uniform and around your face. Do not push goggles or a visor onto the top of the head after use. This could cause contamination of yourself again. Please remove it and clean it. When should we change our mask? It is essential to change your mask immediately after caring for a COVID positive or a suspected positive resident, or when the mask has become damaged, contaminated or damp, started to cause irritation, or it has been partially removed, that is pulled down from the face, and also if it has been removed for a break. The mask must be discarded in these circumstances, hands washed and a new mask used. Just to explain single use and sessional use. Remove the mask after caring for a COVID-19 positive resident after leaving the room. If the resident is not COVID-19 positive, sessional or extended use is appropriate for the mask, but this only applies to the mask. Aprons and gloves should be removed after each episode of direct care given to residents. I'll now introduce you to 2 short videos demonstrating hand hygiene and putting on and taking off PPE. And now I'm going to demonstrate hand hygiene. Just a reminder to have short, clean nails and remove all jewellery apart from a ring, a wedding band that's there normally. So we want to make sure that the water is warm enough to clean well, but not boiling hot. So first of all, we need to thoroughly wet our hands. Apply the soap and lather it well. And then we want to go over to the back of our hands, clean the back of that hand well with the palm of the other and in between the fingers and on the edges. I'm going to swap over to the other hand, do the same again. And then coming back over, we want to look at just getting in between those fingers at the palm. And then cleaning under that ring so it's well cleaned. Want to then go on to cleaning the thumb. And then the fingertips and that little delve in the palm just to give it extra clean. And that one too. And then lastly, we would do our wrists. This should take between 20 and 30 seconds. If we were providing direct care, we would want to wash all the way up to the elbows, but for now we'll just do that. So lastly, we want to rinse off our soap and try and get the water to run back away from the fingertips, just to avoid any dirty soap on the fingertips. Leave the tap for now. Dry our hands thoroughly. And then take a second paper towel, used just to turn off that tap so we don't undo all the good work that we've just done. And one final tip, before you rinse your hands, it is worth just taking one look at the poster just to make sure that you've included every step of that hand washing routine to make sure that your hands are squeaky clean. The first thing I want to do is to demonstrate the donning and doffing. And we've already washed our hands, and then we would start with our equipment. I'm afraid it's very rustly pinny, but first thing to put on would be our plastic apron. Make sure it's well tied behind the back so it doesn't come off in the middle of care, causing you a problem when you've then got a potentially contaminated apron. The next thing we would put on would be our mask. Now, we've washed our hands, so we've got an opportunity now to just press that mask on really well and over the ears and under the chin. So make sure it's comfortable and there isn't a gap around the mask before you commence your care. Next, we would put a visor on, but I'm not going to do it in this demonstration, but the visor would go on next. And last, we'd put on a pair of gloves. It's really important that the gloves are the right size for you. If they're too big, you're going to get some leakage of contaminants within the glove, and if they're too small, they're likely to rip. So you get them on so they're nice and comfortable and ready for your care. And then we're ready for care. It's very important that when we have a suspected COVID-19 positive resident or a positive resident, that we make sure we put on our equipment before we enter the room. We go into the room fully equipped and provide our care. And now it's time to finish the care and take off our PPE. So now we've finished our care and we want to take the PPE off. And if you remember from the presentation, we would only take the gloves and the apron off in the room with the resident, removing other articles when we've left the room. For this purposes, I'm going to take it all off here, but that's the general rule. So gloves first, because our hands have most likely been the most contaminated. We want to grasp the middle of the palm so we're not touching any skin, and remove that glove, and it can stick a bit, and just feed it into the other hand so there's no contamination. For the second glove, we want to be stood near the clinical waste bin, and we want to put our fingers just under the rim or the wrist edge of the glove, and then pull off both things and straight into the clinical waste bin. As mentioned in the presentation, between each one of these steps, we would want to make sure that we wash our hands, to make sure that if we have contaminated our hands in any way, that has been addressed. So we wash our hands and then go for our plastic apron. Just gently pull it out to a level of chest height or below, and then just let that drop down. Don't push it down and get your hands stuck on the outside of a potentially contaminated apron. And then from behind, we'd snap, very difficult stuff, we'd snap the straps. And what we want to do is, facing me at the moment is the inside of the pinny and less likely to be contaminated, where the outside of the pinny is very likely to be contaminated. So we want to fold all of that in, so we're getting rid of that contaminated area out of harm's way, and fold it again, just to double lock on it. And then just gently roll, scrunching along, but not right to the bottom where it's fanned open, just to then pop that in the clinical waste bin and clean our hands. And then we would want to leave the room if we have a positive COVID resident or a resident suspected of being positive. So at that point, after we've washed our hands, we would leave the room and we would go to a designated place to take off the rest of our PPE. So when we get to the designated place, we'd obviously take the visor off and lay it on a designated worktop for cleaning. And then we wash our hands and take our mask off. And so when you take your mask off, you want to make sure that you're just leaning slightly forward, so you're not going to contaminate your face or your clothing, and you can just unlatch that mask, drop it straight into the clinical waste, and clean hands. If it's a mask with straps, then always snap the bottom strap first, followed by the top strap. We do that because when we snap the top strap, if that was to be snapped first, it would drop down onto our uniform and contaminate it. So that's the way order from the back and then from the top and then into the bin. When we finish, we'll put a pair of gloves on and clean the visor according to manufacturer's instructions. And that is the end of our donning and doffing procedure.